Have you ever noticed small bumps on the darker skin around your nipple and wondered what they were? Maybe you spotted them in the mirror one day and quietly panicked, thinking something was wrong. Or maybe you've had them your whole life and never knew what to call them. Either way, you are definitely not alone, and the answer is actually really fascinating. My name is Gig Nurse, and I'm a health educator. Today we're talking about Montgomery tubercles, what they are, what they do, why they change, and when, if ever, you actually need to worry about them. Let's get into it. So first things first, what exactly are Montgomery tubercles? These are small, raised bumps that appear on the areola. That's the darker circular area of skin surrounding the nipple. They can also occasionally appear on the nipple itself. They're named after William Featherstone Montgomery, an Irish obstetrician who gave a formal written description of them in 1837, though a little fun fact. They were actually first described by the Italian anatomist Giovanni Battista Morgagni all the way back in 1719. So these little bumps have been on scientists' radar for over 300 years. Now, technically, Montgomery tubercles are the visible openings of what are called Montgomery glands, or areolar glands. Think of the gland as the actual structure beneath the skin, and the tubercle as the small raised opening through which it secretes onto the surface. You might see them referred to interchangeably: Montgomery glands, Montgomery tubercles, areolar glands. They're all describing the same system. Here's what's interesting about these glands from a structural standpoint. They are modified sebaceous glands, the same type of oil-producing glands you have all over your body. You know how your skin produces natural oils to stay moisturized? Montgomery glands do the same thing, but in a specialized location. What makes them unique is that they also have a connection to the mammary duct system, meaning they have a dual function. They produce skin lubricating oil and they're linked to tiny mammary ducts. So they're kind of a hybrid between a regular skin gland and a breast gland, which makes them pretty remarkable. How many does a person have? This varies a lot. Most sources say you can have anywhere from 4 to 28 per breast, and some research suggests even up to 40 in some individuals. The average tends to be around 10 to 15 per side, arranged in a ring around the nipple. Some people have only a few that are barely noticeable. Others have many that are more prominent. Both ends of that range are completely normal. There's no right number. So what do they actually do? This is where it gets genuinely cool. Montgomery glands serve a few really important purposes. The most well-known function is lubrication. These glands secrete a lipid-rich, oily substance that keeps the nipple and areola moisturized, supple, and protected. This matters a lot during breastfeeding. When a baby is latching and feeding repeatedly, the skin in that area is under a lot of stress. The natural secretions from these glands act as a built-in moisturizer and protective barrier, reducing friction, preventing cracking, and guarding against infection. This is actually one reason why healthcare providers who specialize in lactation recommend that breastfeeding parents not wash their nipples with soap. Doing so can strip away this protective coating that the body is intentionally producing. But here's the part that genuinely surprised me when I learned it. Montgomery glands also emit compounds into the air, essentially scent signals, that help newborns locate the nipple. Research has shown that the secretions from these glands contain volatile compounds that elicit specific responses in newborns, causing them to turn toward the breast and seek out the nipple. In other words, these tiny bumps on your areola are part of a biological communication system between a mother's body and her baby. A 2009 study published in the journal PLOS demonstrated that newborns reliably responded to these secretions, and that masking or washing away these scents made it harder for bobbies to latch and feed. A separate study found that the number of Montgomery glands a person has was actually correlated with how quickly lactation began and how quickly infants gained weight. So these aren't just decorative, they are functionally significant in ways that science is still documenting. Now let's talk about when and why they change in appearance, because this is what often catches people off guard. Montgomery tubercles can become more pronounced or visible at certain times, and hormones are almost always the explanation. During puberty, as the body begins producing estrogen and other hormones, the areola and nipple area develop and change. This is when many people first notice these bumps becoming visible at all. They might look like a ring of tiny pimples or goosebumps, and for teenagers who have never heard of them, that can be alarming. So if you're a young person watching this is completely normal. It's part of how breasts develop, and it's nothing to be concerned about. During the menstrual cycle, changes in hormone levels, particularly a rise in progesterone in the second half of the cycle, can make these glands temporarily more visible or slightly raised. This is common and nothing unusual. During pregnancy, the changes become more significant. The bumps often enlarge noticeably, sometimes quite dramatically, as the body prepares for breastfeeding. In fact, Montgomery tubercles becoming more pronounced is sometimes one of the earliest visible signs of pregnancy. Some people notice the change even before a missed period. About half of pregnant people experience this as a noticeable early change. After delivery and throughout breastfeeding, the glands remain active and enlarged because they're doing important work. After breastfeeding ends and hormones normalize, they typically reduce in size and become less visible again, though they never disappear entirely. They're a permanent part of breast anatomy. Hormonal medications, including birth control pills, certain IUDs, and other hormonal therapies, can also affect the visibility of Montgomery tubercles, since these all influence the hormone environment your body is operating in. So now let's address the question that probably brought some of you here. Are these bumps something to worry about? In the vast majority of cases, the answer is no. Montgomery tubercles are normal anatomy. They're not a disease, not a rash, not a sign that something is wrong. The simple presence of raised bumps on your areola, especially if they've always been there or appeared during a hormonal shift like puberty or pregnancy, is not a cause for concern. That said, like any gland on the body, Montgomery glands can occasionally run into issues. Because they produce oily secretions, they can sometimes become clogged. A clogged Montgomery gland might look like a whitehead or a small firm bump, similar to a pimple. This is usually harmless and resolves on its own. If you want to help it along, a warm compress applied gently to the area for 10 to 20 minutes can encourage the gland to drain naturally. What you should not do is squeeze or pop it. Applying pressure to try to force the contents out can introduce bacteria, cause injury to the tissue, and potentially lead to infection. This is the same advice dermatologists give about pimples on your face. The temptation to squeeze is real, but it usually makes things worse. In rare cases, a clog can develop deeper in the gland's duct, leading to what's called a retroareolar cyst, sometimes called a Montgomery cyst. This shows up as a swollen mass behind the areola, which may or may not be uncomfortable. These are typically benign, meaning non-cancerous, but they can become infected and should be evaluated by a healthcare provider. Treatment usually involves antibiotics if infection is present, and in some cases minor drainage. So when should you actually see a doctor about changes in this area? Here's a straightforward list. See a healthcare provider if you notice redness, warmth, or swelling around the areola that doesn't resolve on its own. If you notice a discharge from one of the bumps that is bloody or pus-like, get that checked. If you feel a deeper lump within the breast tissue itself, not just on the surface of the areola, that warrants an appointment. If you notice nipple inversion that's new, persistent skin changes, like dimpling or thickening, or if you're experiencing pain that's not explained by hormonal changes or a known clog, those are all reasons to get evaluated. The key distinction to keep in mind is that Montgomery tubercles sit on the surface of the areola. They're small, soft, and smooth. A breast lump that's concerning tends to form deeper in the tissue, feels hard or irregular, and changes over time. If you're ever unsure, there is absolutely no harm in asking a doctor to take a look and put your mind at ease. That's what they're there for. Let's also briefly address a question that comes up. Do people with penises have Montgomery tubercles too? Yes, actually. All people are born with nipples and areolas, and the same glandular structures are present regardless of sex assigned at birth. In people who don't go through estrogen-driven puberty or pregnancy, these glands tend to remain smaller and less active, but anatomically they're present. Bodies are more similar than we often think. And one more thing worth saying. Sometimes people feel self-conscious about the appearance of Montgomery tubercles, especially if they're prominent. If you've ever felt that way, know that this is a completely normal feature of breast anatomy. Every body that has an areola has them. Their visibility just varies from person to person and moment to moment depending on hormones, temperature, arousal, and other factors. They're not a flaw, they're a functional feature your body developed for a reason. So here's the quick recap. Montgomery tubercles are small, oil-secreting glands on the areola, named after the obstetrician who formally described them in the 1800s. They lubricate and protect the nipple, play a role in newborn feeding through scent signals, and naturally become more visible during puberty, hormonal shifts, pregnancy, and breastfeeding. The number varies widely from person to person, and that variation is entirely normal. In most cases, no treatment or special care is needed. If they become clogged, warm compresses help, but don't squeeze. See a doctor if you notice redness, unusual discharge, a deeper lump, or any changes that feel off to you. Your body knows what it's doing. Understanding it just helps you trust it. If this video helped you and you want more honest, straightforward health content like this, go ahead and subscribe. I make these videos for everyone who's ever had a question about their body and wasn't sure where to turn, because you deserve clear answers without the shame. Thanks for watching, and I'll see you in the next video.